A typical migraine attack progresses through 4 phases: the prodrome phase, the aura phase, the headache phase, and the postdrome phase. Not all migraine sufferers experience every phase, and each migraine episode can be different. The prodrome occurs in up to 60% of migraine sufferers, hours to days before the onset of headache. Symptoms of prodrome include fatigue, repetitive yawning, fluid retention, increased urination, muscle stiffness, especially in the neck, back, and face, constipation or diarrhea, cravings for particular foods, mood changes such as euphoria, depression, or anger, and difficulty concentrating. The prodrome phase may be considered to be the migraine sufferer's yellow light, a warning that a migraine is imminent. Patients who recognize this phase of a migraine may be able to prevent or avoid them completely by resorting to early treatment. A migraine aura is experienced by 25% of migraine patients before the onset of headache. It usually develops gradually, within 5 to 20 minutes, and lasts less than 60 minutes. Auras are most often visual, but can also be experienced as sensory or speech symptoms. Visual auras are most frequent and usually begin as a small bright spot or as an area of visual loss or scotoma. Often there are scintillations that may occur as part of the shimmering edge of the scotoma. Along the expanding margin, geometric shapes or zigzagging lines often appear. These are called fortification spectra. This visual disturbance gradually expands to involve a quadrant or hemifield of vision. As the aura resolves, vision usually returns, first to the areas of central vision. The sensory aura typically follows the visual aura within minutes and begins as a tingling sensation in one limb or on one side of the face. As the tingling sensation moves across the side of the face or down the limb, it leaves an area of numbness behind. Numbness may last up to 1 hour. The sensory aura may also move inside the mouth, affecting the buccal mucosa and part of the tongue. Less common symptoms of the aura include difficulty speaking and weakness. The slow spread of scintillations, followed by scotoma and tingling, followed by numbness, is quite characteristic of migraine aura. However, since some of these symptoms also occur with conditions such as a detached retina or stroke, these need to be ruled out. The headache phase is generally the most debilitating part of a migraine episode. The headache of migraine is often but not always unilateral. It is commonly localized to the frontotemporal and ocular area, but can become diffuse. The headache is moderate to severe, and as the intensity increases, it tends to become throbbing or pulsatile. Pain is increased with physical activity, such as walking or going up or down stairs. As the attack severity increases, patients frequently experience nausea and sometimes vomiting. During attacks, some patients may experience photophobia, an excessive sensitivity to light, and phonophobia, an increased sensitivity to sound. Symptoms of the migraine postdromal phase are experienced by approximately 68% of individuals and can include fatigue, weakness, irritability, anxiety, depression, difficulty concentrating, and scalp tenderness.